My name is Paul Nagy. I serve as the Director of Quality in the Department of Radiology at Johns Hopkins University, and my mission is to enable frontline teams in improving and redesigning healthcare delivery processes. We found that informatics is an absolutely crucial element in supporting and building effective cultures of quality in redesigning healthcare. From having an MR technologist being able to mine the EMR to look for potential metal implants, to helping the radiologist deliver critical findings to referring physicians. And so we're seeing informatics is becoming a much larger player in solving a lot of the quality problems in radiology as we transition from a fee-for-service model and begin working in an accountable care environment where we work much more closely with referring physicians and with other departments within a hospital, a medical system, and even with other referring physicians. The information systems that we use are vital at providing the data we need to do quality improvement. Quality improvement methods without having access to data are usually starved and are ineffective. We're left with emotions and perceptions of problems without really understanding the data to address them and to address the underlying root causes around them. So I see informatics and the research being done at SIIM as crucial for helping remove the blinders that are holding the radiologist back at being more effective. Those blinders are looking upstream for why the patient is there, for being able to mine through the EMR to understand what was the context for why the patient's having a radiology procedure and ensuring it's appropriate, as well as to make sure they have all the background information for what the referring physician is looking for. The other blinder I see informatics helping us address is the downstream blinder. The radiologists often don't get to see the impact of their report. They don't get to, it's harder for them to ensure the right thing is happening to the patient in their medical care treatment. So being able to track incidental findings, ensuring they're being delivered, ensuring there's a follow-up happening for recommendations for urgent findings and critical findings, ensuring that patient care teams are notified, communicated with, and the appropriate medical treatment is being done on our patients. Between communications and collaboration tools, we're seeing informatics playing a larger role in addressing these critical quality problems for handoff. One of the exciting areas that SIIM is researching in and developing informatics solutions for is helping empower the front line as they do quality improvement projects to look for areas of improvement. And so mining data from these electronic information systems, creating real-time graphical dashboards that provide the frontline providers this understanding what's going on around them in the flow, to be able to avoid bottlenecks, to be able to avoid being in a firefighting environment where they can start looking at systemic delays and really build more effective patient services and better efficient an environment. One of the things we're seeing in informatics to improve the culture of quality within the department is providing mechanisms for feedback. We don't see anymore the ability for the radiologist to have as much interaction with the technologist as they did before. Now they might be remotely located. And so being able to provide informatics solutions to provide effective feedback on quality control for image quality ensures that there's appropriate feedback going back to the technologist to make sure that they're doing the work that they need to do to enable effective decision making and effective diagnosis by the radiologist. And so we see informatics tools being very effective at delivering these type of feedback mechanisms. Another area that we're seeing really exciting is a lot of our referring physicians throughout the hospital on and off campus are now having mobile technologies like the iPad and the Android tablet platforms. And so for the first time, we really have mobile technology where we can reach out and collaborate with referring physicians directly and be able to enable the consultation and deliver that value to them around the interpretation of the diagnosis. And so these things have a strong impact on the patient care, the treatment they get, the timeliness of the treatment, and ensuring follow-up around recommendations. Too often, a lot of the quality improvement methods that we use to improve healthcare are done with very analog techniques, where they're using a stopwatch to look at a process or using paper to track the flow of a patient. And so what we've found is that informatics and IT can have an enormous potential on quality improvement efforts to redesign healthcare, whether it comes from designing safer environments for putting an MR into an operating field, to how we track dose on patients or do screening for contrast reaction, or how we're engaging with the patient. There's a lot of opportunities with informatics to be able to really empower us to be more effective in how we measure quality in the Department of Radiology. When I think of quality management, I think of it as, so a lot of IT is strategically driven, where it's done every 3 to 4 years as a forklift, as a major a major investment capital for a hospital, where quality initiatives are done locally from the ground up, from employees trying to redesign their environment. So it's much more of an organic method. And so quality is about internal leadership efforts to try to re-engineer processes. And so so in some ways it's trying to map our techniques instead of towards strategic initiatives that do every 2 to 3 years, but to move at a much faster speed that moves at quality improvements of a 3 to 5 month cycle, where we're able to be much more agile and adaptive to local changes to make the practices more effective in what they're doing. We also see the quality movement is transforming healthcare, and that's really about internal leadership and physician leadership, trying to just demonstrate value as opposed to being forced out externally through regulations. And so we see these different pressures from price transparency and through the other big efforts to reform healthcare, and the internal efforts of trying to reform healthcare are really led by the quality movement. Well, it's fun because a lot of the stuff is right. I see this as just how you define quality management in some ways. For me, it's the progressive management techniques of engaging the front line and empowering them. And then getting their creativity and then getting their insights on how to improve their environments to make it more efficient and to understand how they can help the patient better. Instead of coming from some CEO or from some top-down environment, it's really about listening to the provider and partnering with them on a very personal level to see what they see and being able to understand how to make sure technology is working for them and providing them the innovation that they need. We're seeing all these technological innovations coming from other fields, but really has to be tailored through the lenses of the frontline provider to see how they're going to be able to use that technology to aid them to provide better care. Quality management, supporting the quality improvement efforts in healthcare is one of the strategic initiatives of SIIM, because we see that's where a lot of innovation is happening on the front line, really trying to understand how we can use technology to provide more value to our patients.